Hi, and welcome to Coping During the COVID Crisis. I'm Janet Gross. From the very beginning of the pandemic, we've seen the virus assault bodies and minds, emotions, and economics. Everyone has been impacted in one way or another. Dr. Roy Salgado, professor of counseling at the University of Holy Cross, joins us to talk about the toll this can take and how it can lead, in some cases, to something else, a disorder some might not expect. And, we were talking about this before the show started, but there are things that can lead to something as horrible as post-traumatic stress disorder.
Yes, and I don't know if you recall, but early on when we started to talk about this, you had posed a question last year. I wonder if this would lead to post-traumatic stress disorder. And we're finding that people are, in fact, a year later now, displaying symptoms associated with post-traumatic stress disorder. We have had a couple of waves. We are perhaps what we would refer to as the second wave of this pandemic in this state, in this area, in the New Orleans, greater New Orleans area.
Say third wave.
Some people say third.
We don't know. Whatever it is.
Whatever it is. So we're in the second wave. The first wave, if we can recall back to last year, back in March and April, the numbers went up. Right after Mardi Gras, the numbers went up, and people got sick, really sick, and people unfortunately died. We had a high contamination rate, we had a high infection rate, we had a high death rate during that time. Fast forward a year later, nearly a year later, and there are people who perhaps had been impacted at that time, and now there's new people that are being impacted. You may have had an aunt or an uncle or a relative who acquired the contagion last year, and now you have new members of the family acquiring the disease, and they're terrified. And the PTSD that is associated with that, wondering, is this going to happen to us again? Is this going to impact us again? And whether or not the circumstances may be different, maybe the circumstances centered around the initial situation are different than the circumstances centered around the current situation for a given family or system or community. But because of the lived experience that is real, that actually took place, there's a heightened sense of awareness and fear and panic that sets in and is legitimate. And these flashbacks that come back to what has already been lived that is impacting perhaps the way a person functions in the present day.
Well, explain, what is PTSD?
So post-traumatic stress disorder is a diagnosed anxiety mental health condition. It is an actual disorder, it's a diagnosis for someone who has experienced a perceived or real threat to life. So if you have had an experience where your life or the life of someone near you was threatened, real or otherwise, after that event has passed, if over a period of time when the threat is no longer there, now you still feel as if the threat is still there, then the symptoms arise. We all should experience in a typical situation a heightened sense of fear or anxiety when there's an actual threat. It's the alarm in our body saying, alert, 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 danger, 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 threat, threat, threat. So we need to pay attention to it. But after the threat subsides, then the alarm system goes off and you should be able to go about your world. But when it's still on, when it's still that threat, that perceived threat beyond the situation, then perhaps you don't function. Perhaps you can't think clearly, you have a lack of concentration, you have nightmares, you have a change in appetite, you can't do your homework, you can't do your work, you can't function in your daily living activities. All of these things are impacted as a result of believing and feeling that that impending threat and doom is still around the corner. And this second wave perhaps is increasing that in many people in our community.
And I guess because the threat here has never really gone away.
Right.
So day by week, whatever, it might come back. So does prolonged threat like that, does that have even more of a push toward PTSD?
Yes, I would say that just having that threat out there lingering, because it hasn't gone away, it's constant, it's 24/7, and it's there, and it's real. It's not an imagined threat. It's a very real threat. The thing is that here in our area, we had that spike, that peak back in March and April of 2020. And then here we are in present time, and we have a new peak, a new spike. And so there was a time where we slowed the spread for several months. Good for us. We were able to do that. That kind of perhaps gave people a sense of security, a little time to have a reprieve. But now, as numbers go up, we remember. We remember what we experienced as a community, as a country, as a world. And so that perceived threat is there. And even if it's not knocking on our door in the moment, but because we may have experienced a loss of someone a year ago, we may have experienced someone being deathly ill a year ago, we ourselves may have gotten sick a year ago, we don't want to experience that again. Some people got really sick and they survived it. But now they're apprehensive to do things and go about because they remember what it was like. They remember to have the difficulty with breathing. They remember the headaches. They remember the body aches. They remember being incapacitated for days and weeks. Who wants to go through that again?
Right.
And so that fear is there, just wondering, could I potentially contract the virus again?
So there are going to be symptoms of this, of course, for somebody to recognize.
Yes. If you are stopping your life, if you are not going about and able to meet your daily functioning needs, that is certainly a sign. Having nightmares, having flashbacks, cold sweats, your relationships are being impacted by your inability to be able to do daily activities. All of these things are perhaps some symptoms to keep in mind to see if maybe you do meet the criteria for a diagnosis of PTSD.
And there is some help to talk to a counselor. The University of Holy Cross offers a free service. Can you tell us?
Yes, the Maronites of the University of Holy Cross have been offering this service free of charge to the residents of Louisiana for the year now, and there are counselors in training waiting to take those calls. We have an administrative assistant who takes the call, triages it to the clinical director, who then assigns it to a counselor in training who could help you if you believe that you are experiencing some of the symptoms that meet the criteria to PTSD or any other presenting issue that you may have.
Okay, and we're going to talk about a little bit more about that in just a minute. When we come back, we're going to talk more about the counseling service and possible ways to deal with the stress and perhaps PTSD over all of this coronavirus situation. Stay with us. Welcome back. As we mentioned, the University of Holy Cross has been offering and providing free counseling sessions since the beginning of the pandemic. To talk about how these counselors are trained to help with issues, including PTSD, we've asked Dr. Ryan White, director of the Thomas E. Chambers Counseling Center at the University of Holy Cross, to join us. Doctor, that training allows counselors to identify this situation and many others and address those concerns, right?
Mm-hmm. All of the students in the graduate program in counseling take a course that reviews the DSM, which is our diagnostic manual, and all of the various psychological disorders that clients may present with, that they may be dealing with. And although they do not participate in the process of diagnosis themselves, they are trained in various techniques and various strategies for helping clients manage the symptoms of those disorders, post-traumatic stress disorder among them.
So often, I guess, people might not know, like Roy and I were talking about triggers and symptoms and things like that. They might not know about that personally, but these counselors might be able to see that.
Mm-hmm. So for the client who is experiencing the lingering after effects of the trauma, which research has shown has a number of effects on the body, on brain chemistry, they experience these primarily in their feelings, as anxious responses, as fearful responses, whereas a counselor can help shift that, perhaps, based on what the client would best respond to a more cognitive behavioral perspective and approach, where the client is able to become introspective and work on processing their thoughts and their feelings differently so that they can behave differently when they encounter these triggers, when they have these post-traumatic responses, long after the fact.
Our counselors in training are not only trained and educated with regard to the symptomology and the triggers that a client may present, but they also have a knowledge of the history. When you think of post-traumatic stress disorder, people may not necessarily be aware that it initially had been called shell shock in military personnel. Many decades ago, you would have military who would come back from combat, and the perceived threat of war was no longer there. They were back in civilian life. Yet, they had nightmares, they had cold sweats, they had triggers, perhaps a sight, a sound, a smell, a touch, something would come in through one of their senses to trigger the fear and the anxiety, that heightened sense of perceived threat that in the instance was not real, but perceived in the moment because of some trigger based on a memory or a flashback of what had been real, a real, true, life-threatening event. And now we see that it is generalizable not only to military combat veterans, but also to survivors of domestic violence, sexual assault, human trafficking, all sorts of different situations, sexual abuse and trauma. And I would say that COVID perhaps could be added to that it was a very real threat. It is a very real threat. A pandemic that we in our life had not experienced. Sure, we have had pandemics in our histories, but no living person has a memory of it in this sense. Right. And so we're experiencing it. So if someone was impacted by it directly and there was a life-threatening experience in the moment, now that we're in a second wave, if you will, then those flashbacks come back. All of those triggers, either through the sight, sound, taste, smell, something is coming through that just brings it all back, and then the panic sets in.
Do new events add to that? Maybe not life-threatening, but certainly lifestyle, like loss of money, jobs, apartment, homes. Those things are all, building up too, on top of all this.
Any one of those things could serve as a potential trigger that comes in through our senses to give that person that sense of threat, life-threatening threat, that would perhaps contribute to the criteria, the symptomology of a diagnosis of PTSD.
So, Dr. White, as the counselors are dealing with so many issues, and something like this pops up, I guess, are there questions that the counselors might be asking clients, or clients might be asking counselors about, well, this is happening now too, and this is happening now too, and so you kind of build like a profile, kind of, to see what might be a good way to handle this?
So that's going to depend on, the individual's circumstances, but also their recent experiences. As was just pointed out, the daily stresses of life do not cease during a societal event. In fact, they're likely to be exacerbated by it, complicated by it. So all of the regular stresses that the person will be dealing with become complicated by experiencing them, living them during this pandemic. The comparison that I think of, if we're going to bring up history, not only the shell shock for military veterans, but a lot of research, historical research, has shown that there were a number of societal shifts after the Great Depression, because that was a collective trauma that many in society had experienced, and it had lingering effects on their worldviews, on their thought processes, on their behaviors. And our counselors are educated to be able to help clients understand what they are living through, how it is affecting them, and how, if they are going to change their behavior in response to it, they can do so in a way that is to their benefit rather than to their detriment.
And it is true that historical context of those veterans who perhaps came back from World War I in particular, when it had been labeled shell shock, and then shortly thereafter in the 20s, the market crash and the Great Depression and all of the societal macro-systemic things that exacerbated those situations. Here we have this impact of COVID-19, and then with the lockdowns and the economic impact that has had, there is this additional component that generationally impacts people. And we still are wondering what that may look like. What is this going to look like for this generation as they develop? How is that going to impact? We have come to learn how the Great Depression has impacted an entire generation, that currently are now in their 90s perhaps. But people who are now young children, adults, young adults, how is that going to impact them in any given area developmentally? Perhaps you might see them respond in a certain way, or any of us respond in a certain way that meet the criteria for a diagnosis of PTSD. Time will tell.
Wow. Okay. So as you deal with this for training counselors, and I'm sure it's constant training and constant supervision, does everything kind of change with the what you're hearing from clients, with the news itself, with all the things? You have to take so much in to help the counselors do the best job they can.
Absolutely. And that's one of the reasons why you can't have a canned response to something like post-traumatic stress disorder. You can't say, oh, well, this is the list of symptoms that are going to present, and these are the things that you're going to do to treat it, then the client will be better. The counselor needs to take in all of the information about the individual client, about their personality, about their past experiences prior to this, about their experiences during this, in order to craft the best therapeutic treatment for that person, or for that person and their family in the case of family counseling. And it is the instructors and the supervisors who assist the counseling interns in being able to develop those very individualized responses through our training and supervision.
So a lot of people are paying attention.
A lot of people are paying attention, and not only the assigned counselor in training, but Dr. White in particular as the supervisor and clinical director of the center, and then any faculty member who is assigned as a supervisor to those cases as well. There are a lot of people paying attention to what may be going on with a given case.
So you're getting a really good opportunity to have counseling and counselors who are being counseled, and
an accurate assessment and intervention for the presenting issue.
All right. Well, Dr. White, thank you so much for joining us and for your expertise on this and helping us kind of walk through what a counseling session would look like, especially when you're dealing with something as serious as PTSD. We thank you for joining us. And we'll be back in a minute. Stay with us. As we continue our conversation about COVID and PTSD, we're joined by Dr. Michaela Hartline, Assistant Professor of Counseling at the University of Holy Cross. Dr. Hartline, you know the UHC program, you supervise, you're a counselor yourself. What are people facing when things seem to get to be too much?
Just that sense of anxiety that is present right now with everything, whether they're concerned about, leaving their home and being exposed to individuals, or, if they have had COVID, the reality that this is a lot more serious. They are hopeful that they're not one of the individuals, but, when we see and hear on the news about individuals on ventilators, so when any type of sickness arises, it's very common for the flu and other viruses to be going on right now, but anytime an individual starts experiencing any type of illness such as nausea or fever, it's hard not to go to that worst case scenario of the uncertainty in regards to COVID and how they may be reacting with this virus, since we do know a lot more than we knew at the beginning of this year, but there still is a little bit of uncertainty that is still present. So it's just a lot of anxiety that is present, a lot of fear, things like that.
And in particular for those individuals who were directly impacted in the beginning, in the onset, either they themselves got really sick with severe symptoms and overcame it, or someone that they knew got really sick and overcame it, or someone that they knew and loved passed away. If they start to experience a thought, a symptom, physiological that could be related to what would be perceived as a COVID symptom, then all of that can start to come back, whether it's an actual positive test for COVID or otherwise. And that's what would trigger the flashbacks and then the terror and the perceived threat, because they had lived it, they experienced it. No different than the person who had experienced an assault or the person who was at war and now they are reliving the experience. And counselors in training have the skill sets and the ability to be able to ground that individual and let them know right now you're safe, right now you're breathing. So whether it's a combat veteran who You tell them right now you're not back in Afghanistan. Right now you're not back in Iraq. You would do a similar thing with a person who is struggling with COVID. You would ground them, or with the perceived threat and the panic and the post-traumatic stress symptoms. Right now, you're good. And just reassure the individual, and then, you know, have them collect the data and all of that to be able to temper those fears and those concerns, because it's real.
Yeah.
And it's a real experience that had been experienced many months ago by the individual, and it hasn't gone away. It's still out there in the world.
Dr. Hartline, this is obviously you went through the program, the counselor in training program. You did all that, and now you're a doctor. But the program itself, it works. You can, because you were there in the front lines, I guess, helping people through this, whether it was through telemedicine as it is now, or even in person. They come to you with a concern anyway, right? Do people who may be experiencing this, do they recognize these symptoms in themselves?
I mean, at times they may feel that they're overreacting in situations. So like Dr. Salgado said, you know, having them realize what is going on in the moment and letting them know that they're okay, and almost normalizing those feelings. You know, it's okay to be scared. It's okay to be these things, but let's focus on, you know, right now and in the moment, you know, you are okay. So absolutely, you know, we are trained and, you know, at the university with the individuals seeing people, they're under supervision with licensure. So there's always that sense of, you know, they're not in this alone. You know, both the clients as well as the students, they have all the tools they need right there in the moment. So to just be able to normalize and be present, because we have to remember that not only are our clients experiencing this, but our students are experiencing this also. You know, they're also in this moment and they have these fears just like their clients. So to be able to speak with the faculty that are there and to be able to process everything that they're getting is really important during this time as well.
You know, and the students do get an excellent education there. The counselors in training get an excellent education. I was at a meeting not too long ago with a former student of ours that graduated many years ago, and she just went on and on about how she was able to become the consummate professional because of the training that she had received at the University of Holy Cross. And so whether they are a counselor in training at the center, helping people through the pandemic through telemedicine, or already out in the field as licensed professionals, they have the requisite skills to be able to assess, diagnose, and treat clients in our community so as to help them with whatever the presenting issue, PTSD or otherwise.
And just like Dr. Hartline was saying, they're never left alone. It's not like, go, you take care of all these clients and we'll see you Tuesday.
We are there 100% on top of it, making sure that the top-notch quality care is being provided by the counselors in training along with the supervisors who are licensed.
You know, I know we're talking about people who, you know, might have been affected when we're talking about clients or people who are really affected by PTSD. It could also be, it doesn't have to be someone that you love went through this. I'm thinking about like healthcare professionals themselves who've seen the so much trauma, so much death that they couldn't prevent, although they did everything they could. You know, people in nursing homes who are caring for people, family members, all those things, just it builds up in you.
Vicarious traumatization is a very real thing, and people who are exposed to that, you know, we as counselors experience vicarious traumatization. You know, we talk to people who are facing real mental health issues and concerns and real worries on a regular basis. So we ourselves have to be in check to do self-care so we ourselves aren't dealing with vicarious traumatization, just like a medical health provider would be out in the front lines working with patients who have contracted COVID-19.
So you're really, Dr. Hartline, you're really taking care of, as a counselor, you're really taking care of two people in that room or that space or that Zoom.
Absolutely. You know, our job as a supervisor of the University of Holy Cross is to not only worry about the client and making sure that they're getting the best care, but also the counselor that's in training, because this is a new experience for them. You know, they're starting to learn these skills and, you know, they're just getting a few hours under their belt. So we have to make sure that both the client is okay as well as the counselor in training, because it's hard, especially when you're new in the profession, to not, you know, take some of these things home and, you know, kind of take on that worry that, you know, their clients is experiencing them. So to be able to be there for both of them, it's very important as the supervisors of the university.
Okay. Thank you, Dr. Hartline, for joining in the conversation. We really appreciate you. And hopefully we'll get you back on here another time. Okay. Roy, before we go, any tips, any last thoughts?
Yes, I would say that, you know, we are to continue to follow the CDC guidelines, but it's important that if you experience symptoms associated with PTSD, to know yourself. It's important to have a baseline and know what you typically feel and experience on a daily basis, and if there's a change, you would know that if you truly know yourself. Assess your thoughts, your feelings, your body, your behaviors. Know that you're not alone with this and that you can seek professional help with a counselor, and pray. I think we're in a time where a lot of prayer would be very helpful.
Anytime is that time, yeah. But and also, when you're mentioning the tips, I'm thinking that's also for somebody who knows you or you know, to be aware of those changing moments to help them through all this and to pray for them.
Yes.
Okay. All right. Well, thank you, Dr. Roy Salgado, and your colleagues at the University of Holy Cross for joining us. And we want to thank you for watching. We want to help as we are all coping during this COVID crisis.